This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
It is called the silent thief of sight because people who have glaucoma don't often have any symptoms. And once you lose your vision to glaucoma, you can never get it back again. So as far as part of Glaucoma Awareness Month, we want to help you educate yourself on the disease. Joining us this afternoon is Dr. Jason Yonker, glaucoma specialist with the Chesapeake Eye Center. Thank you for joining us today.
Thank you
for having you here.
Yeah, thank you for having me.
So is it true a lot of people could have glaucoma now and not even realize it?
Oh, by far and away. I mean, up right now, the estimates are about 4 million Americans in the U.S. have glaucoma. Only about 2 million know it. And it's amazing when you're in practice, you see this all the time. There's probably a handful of patients every week that come in thinking that they have something else, problem with their glasses, maybe a cataract, and they come in with blurring vision or some other problems, and they actually have to tell them that they've lost a significant amount of their vision from glaucoma, and there's no way to get that back.
So can you show us what it looks like without glaucoma and with glaucoma so that we might have
I think we have a couple images. Now this would be obviously your vision as without any kind of impairment.
Right.
And essentially what glaucoma does, and it does this so slowly and asymmetrically between the two eyes that you're going to lose peripheral vision. And it slowly creeps in until eventually it starts getting cloudy enough to where the patient sometimes will notice that they're starting to having a problem with their vision, and by then it's too late because you can't get any of that peripheral vision loss back.
So are there any symptoms that maybe we can keep an eye out for?
The downside of glaucoma, the trouble with it, is it's a symptomless disease, just like high blood pressure. You know, you don't know you have high blood pressure unless you go in to see your primary care physician.
Right.
Well, with glaucoma, it's the same type of thing, but unfortunately, unless you have problems with your eyes, you're not really going to an eye doctor. So what we recommend is anybody over the age of 40, especially with a family history of glaucoma, or of Latino or African American race, get in, get screened, get that baseline examination, because we can look at people's eyes and actually see whether they're at risk of developing this difficult condition.
So there are some things that we can do as far as prevention, which would be...
Yeah, so for prevention, like I said, symptom-wise, there's not a whole lot of symptoms. Blurring vision, halos around vision.
Right.
Sometimes you can have pain around the eye, redness around the eye. Worst case scenario is if an attack of glaucoma, sometimes you can experience nausea, vomiting, or headache. If you do experience any of these things, obviously you need to get in and get screened as well. But as far as prevention, it's really more early detection, and that's really where we hone in on, is detecting it early and treating the patients early. And the majority of patients, once we detect this condition in its earlier forms, is able to be maintained usually on eye drops and can maintain excellent vision through their lifetime.
So be proactive.
Exactly.
All right, well, let's switch gears for just a second. There are a lot of people that don't have glaucoma,
right,
but they still have a hard time seeing. Vision's a problem. Now, there are some cutting-edge procedures that you have that help address that.
Oh, we're in a great time for ophthalmology. I mean, we've got so many different things that we can offer patients, and it starts with things as simple as glasses. Glasses have really been revolutionized with the new digital technology. Before, the main problem, a lot of patients will come in and say, well, I've got these bifocals, I can't stand them, I can't wear bifocals, I can't stand a distortion, it's giving me, it's hard to read, hard to find the spot on there where I can see clearly with my bifocals. Well, with the new digital lenses, the space that you can actually see through has been increased. So you're getting a bigger sweet spot on your glasses for when you're looking through the bifocal segments. And also the fishbowling effect, or the distortion that occurs with the glasses, has been very much minimized with the newer digital lenses.
I've had that problem a lot.
Yeah.
Specific scenarios that you can think of that was really helpful.
Specific scenario would be my wife, who never wants to wear glasses. Highly myopic, which means highly nearsighted.
Right.
Puts her glasses on, she can't stand it. She goes, all the peripheral vision is limited, I'm have a hard time, so I want to wear my contacts all the time. And then as an ophthalmologist, I tell her that's not a good idea. You want to stay out of your contact lenses and give yourself what we call contact lens holidays. Because if you're in them too often, you can get problems with wearing the contacts. So with the newer digital lenses that are out there, that distortion in those high prescriptions, the high far-sighted prescriptions and the high nearsighted prescriptions, has been significantly minimized.
On occasion, I've got problems with my computer monitor.
Yeah.
Is that?
Very common. And one of those problems is because those sweet spots in the lenses are so small,
right,
you kind of have to get your head in a certain position where you can kind of line up your bifocals. So a couple fixes. One is get a pair of glasses specifically for the computer, which is one option. Another option are the digital lenses, which increase your bifocal segment sizes. You can increase your frame size, which is going to give you bigger sweet spots on your lenses. And then the other issue is something we're seeing oftentimes. About 90% of patients that are out there using their computer a lot, like a lot of us are, is a computer vision syndrome, they kind of term it. And I give patients a 20-20-20 rule of thumb to do. If you're on the computer for more than 20 minutes straight, take a 20-second break, focus at an object in the far distance, and give 20 good blinks. And that'll re-moisturize your eye. the muscle inside the eyes that is doing the focusing will allow it to come out of spasm, and it usually will alleviate the symptoms of blurriness and headaches that's sometimes associated with prolonged computer use.
How about that? Never heard of that. Okay. Oh, so let's talk about contacts. What about when they feel dry, maybe a little scratchy?
Okay. One of the things is sometimes is overuse. You know, if some patients are going to be in these contact lenses from the start of the day till the end of the day. I never recommend sleeping in the contact lenses. Some of the lens companies will say that you can sleep in the lenses. You put yourself at a lot of risk of infections. If you're feeling gritty, one of the most common things is dry eye syndrome that's undiagnosed. About 22% of women that are postmenopausal are suffering from this condition. So that's another common entity, is that women will come in who are postmenopausal having a lot of problems with itchiness or stinging, scratchiness with their contact lenses, and a lot of times it's dry eye syndromes. Some of the things you can do for that, switching over to a daily contact lens so that you can actually just throw them away and dispose of them, which you don't have to worry about cleaning the contact lens. And the other thing you can actually try, which is very easy to do, is omega-3 fatty acid supplementation, or fish oil. 1,000 milligrams twice a day, if you know what to discuss it with your physician, is something that actually improves the tear film, improves the comfort of the contact lens in patients as well.
What about driving at night?
This is one of the big complaints that you have. People come in, they're going to say, I'm having a lot of glare, I'm having a lot of halo, I feel uncomfortable on the road. One of the things first you can try, sometimes it's just glasses. You can actually add an anti-reflective coating, or actually the anti-reflective coating can be added into these newer digital lenses that we're talking about. So you're going to get less distortion from the digital lens. You're going to get less glare and halo from the anti-reflective coating. If you're still having that problem, there can be medical problems with your eye that you need to get diagnosed. And one of the big ones is cataracts. And so, especially if you get into your 50s, 60s, 70s, you may have some degree of cataract that's giving you some of those complaints as well.
Dr. Jason Yonker, Chesapeake Eye Center, thank you for joining us.
Thank you for having me.
Great information there. Now, if you'd like to read more about glaucoma or learn how Chesapeake Eye Center may be able to help you see better, just go to delmarvalife.com and click on the show tab. Well, still to come on Delmarva Life, if you have a child with disabilities, you probably do everything you can to look over them and look out for their best interest. Well, what do those parents do when their time on this earth ends? Well, up next, how to protect the futures of special needs children. But first, if you're looking to buy something, maybe a particular item or a gift for somebody, but you don't know where the store is, all you have to do is go to delmarvalife.com. Upper left-hand side of the screen, you'll find the Super Search. Type in the name of the category or the business that you're looking for, and there you go, an entire directory just waiting for you. Delmarva Life, we'll be right back.